to news in this country and to do with COVID-19. Well, the country is not yet in the fifth wave, but the country has seen a steady increase in COVID-19 infections over the last 2 weeks. In the last 24 hours, for example, the numbers increased by nearly 5,000. To speak to us more about the rising number of cases, I'm joined now by Dr. Nicholas Crisp, who is one of the Deputy Directors General in the National Department of Health. So, Dr. Crisp, in terms of the trajectory and evolution of the COVID-19 situation in the country, not necessarily in the fifth wave, but where are we in that trajectory? How are we looking?
Yeah, good afternoon to Lesizwe and good afternoon to the viewers. It's a very interesting development now with this approach to the fifth wave, or what we believe will be a fifth wave. It's very different from something we've seen before. Normally a wave is caused by a new variant, but we are not seeing a new variant yet. We've got what's called a subvariant, where it's still Omicron, but there are a number of different Omicron children, if you like, that are in circulation at the moment. We know about the BA.2 that was dominant here for a while and that has caused trouble in China. We now have a BA.4 and a BA.5 with slightly different mutations in their structure. But between them, they are causing, well, they are responsible for the cases we are seeing during this rise. Whether that's because of something different in the virus or whether it's because we are all behaving differently is not clear. We have got a lot more freedom than we had. We've moved around a lot during the Easter holidays, and there's a lot more of us communing with others without masks on and unvaccinated. So it may not be that there's a new circulation yet. It may just be that it's this behavior of ours that we need to contain.
So what then do we make of that information in relation to our readiness? If you are saying that, you know, when we talk of the next wave, usually we would be talking and associating it with a new variant, but in this instance, we're talking about two sub-variants of the Omicron variant, BA.4 and BA.5. What are the implications then for us for readiness in terms of the health system, in terms of any behavioral changes that we might need to choose or have imposed on us?
So this may just be a flame of the failure to put out the fire of the Omicron that we're dealing with. We had 5,472 positive tests today. The test positivity rate, that's the number of tests that are done that turn out to be positive, is still high, still sitting around 18%, which is way too high. So we know that there's a lot of virus that's in circulation, but it's still Omicron. So we need to prepare. We are seeing an increased number of people being admitted to hospital across all age groups, but it's very small numbers compared with what happens with a completely new variant. This may, of course, rise in the next week, and we will need to wait and see whether that happens. So what do we need to do as South Africans? We need to continue to wear our masks when we are in close proximity to other people. We need to make sure that we remain in well-ventilated areas, especially if we are not wearing masks, such as when we are outdoors. We must get vaccinated because we know that once exposure to a wild virus is not enough to give us immunity to protect us against severe infection, and we need to have repeated exposure from the vaccines with our primary doses and booster doses. And we need to continue to wash our hands and have normal hygiene so that we don't touch one another and spread the virus, which we know is spread through droplet spread. So pretty much what lies ahead of us is in our control as individuals, and we can protect those around us if we take these simple measures, especially going and getting vaccinated. And we repeat this again and again. You do not need to wait until we get a new variant or until these subvariants get out of control. You need to go now and get vaccinated.
Lastly then, Dr. Crisp, and briefly, tell me about the processes around the regulations around which you had called for public inputs, which are meant to coordinate and guide our response, not only to COVID-19, but to other communicable diseases going into the future. With the situation evolving as it is now, would those regulations be ready for you such that we wouldn't have to resort back to the national state of disaster and have regulations passed in terms of that law?
Well, obviously, we would not like to go back to the national state of disaster across the country and even at parts of the country. So there have been hundreds of thousands of inputs made. We've had a team of everybody that we could mobilize in the department working for the last few weeks on this. And we are hoping that by the end of the weekend, we will have had the summary of all the inputs. We have had a legal team working with us, advising us. And we will look at whether we need to have short-term, purely COVID regulations and deal with the other regulations as a longer-term issue, or whether we will be ready to make amendments to all the regulations in time for the 5th of May.
All right. Kora, thank you for your time. Dr. Nicholas Crisp there from the Department of Health, where he is Deputy Director General, weighing in on the evolution of the situation around COVID-19.